It's a real pleasure now to introduce Judith Paget, who's the Director General for Health and Social Services in Welsh Government and Chief Executive of NHS Wales, and someone who I can say is really interested in and supportive of the research agenda in health and care. And Judith has joined us to finish the conference, but also to make a few awards. And I'm looking around slightly hopefully that somebody from the Health and Care Research Wales team is going to come forward with the awards and so on. I'm relieved. Like all researchers, I was looking really carefully, but in the wrong place. Judith, shall I hand over to you?
Diolch, Kieran. Penhandar pawb. Absolutely brilliant to be here and to see so many of you in the room for the last session. So thank you, and a great last session it was. I managed to listen to most of that. There's nothing I like more in this role than to be able to say thank you to people, but also to present some awards. And so this session is a great opportunity, first of all, to thank Health and Care Research Wales for inviting me to close the conference this year, but also to present those awards, which I will do in a couple of minutes. And I also know that a lot of really hard work, and you'll know this too, goes into organising, planning conferences such as this one. So I just wanted to add my thanks to Kate Myers, Cheryl Lee and Paula Hughes and the whole of the Health and Care Research Wales communications team for the fantastic job they've done today in getting us here, getting the speakers here, getting the panel going. So thank you. Well done. You get a round of applause, and so you deserve it. I'd also like to thank all those who were involved in giving presentations, a huge variety of topics on the programme today. The panel discussions I know have been well received. And also thank you to the people who've joined us with stands and exhibitions, a really important part of the conference to make sure that we have an opportunity to have a look what's going on. And so thank you to colleagues as well. It's been since 2015, actually, that this conference has been a real focal point for health and care research in Wales, bringing together the health and social care research community to gather together on an annual basis. First time in person. It's really great to actually be to an in-person conference. Since I've been in Welsh Government, which is just coming up for a year now, and this is probably only the second in-person opportunity I've had to meet people, so it is really great. So thanks, Kieran, for inviting me. The overall theme of this year, where would we be without research, emblazoned around the room, I know, highlighted and showcased some really important health and social care research that's been taking place across Wales, the important topics that the research community is embraced in and focused on, and some of those achievements we're going to celebrate shortly with our Health and Care Research Awards. And I know who's won, so it's really nice to be able to present those. I think also it gives us a time to reflect. We have hugely busy agendas, don't we? Hugely busy working lives. Time to just stop and reflect on all the great work that is actually going on across Wales and in the health and care research community. Absolutely fantastic. You should be really proud of everything you're doing, from the frontline clinicians that I've met many of them in my working life, and also to the lab technicians and everybody who's involved in making sure that we're preparing for clinical trials and all those sorts of things. They are so important to our research and moving our health and care system forward. I think over the last 2 years, it can't have escaped any of us that we've seen huge change in the way in which care is being delivered, of course, in NHS Wales, but not just in our NHS. The impact of the pandemic, what that's done to how we work, how we interact with each other. But all through that process, one thing that I reflected on constantly was the huge sense of collaboration, and that people across Wales, whatever their background, whatever their discipline, really working together to actually improve our health and care system and the health and care of people of Wales. So thank you to everything that you've done to be part of that. It's really, really important work, a crucial effort for for everybody, and a crucial effort now going forward as we come through the next stage of the pandemic, because it's still with us, and actually learn to recover and change and build on all that innovation that we had during the pandemic. I know that this year Health and Care Research Wales launched the Research Saves Lives campaign, looking at the real impact the research community is having on the way in which care is delivered. And there are so many examples now, aren't there, of the way in which research has impacted on the way in which care is given, the treatments that are available, the treatments and how they're offered, where they're delivered, etc., and from insulin to asthma pumps, and of course, one of the most recent, the COVID-19 vaccine. And of course, working in Iron Bevan in my last role, we were really involved in the trials of the vaccine as well. So, and we were really, really proud to be part of that. Talented people, talented scientists, researchers, doctors, nurses, everybody across the health and care system working together to actually make a difference, to develop groundbreaking medicines that help us care for the people of Wales. And so in closing my few remarks before I move on to give out those awards, which I know is the bit you really want to get to, I just want to say thank you once again for all the hard work that you're doing. I thank you again to the conference organisers for making this possible. This is a huge event on a scale that can't be underestimated in terms of organisation skills, so thanks to everybody. Please don't forget to keep tweeting about the conference, because when everybody gets home tonight, they'll be looking on Twitter and finding out about all the things that you enjoyed about the conference and all the things that you remember and reflect on. So please keep using that hashtag ResearchWales22. Thank you all very much indeed. So with the help of my colleague, standing discreetly on my left, we're now going to move straight into the awards and to find out who's going to be the winners this year in our Health and Care Research 2022 awards. So, and they are a real celebration of all that's great in the research community in Wales over the past 12 months. We've got 3 awards. We've got the Public Involvement Award, the Impact Award, and the Rising Research Star. So thank you to everybody who has entered, and also thank you to the judging panel for their time and contributions. I know how much of a difficult job it is to judge these sorts of awards, so thank you as well. So the winner of each category gets funding of £250 to attend a training course, conference, workshop, or similar event to develop an area of their research skill set. So as I'm making the announcement, please again feel free to share your congratulations with everybody. I'll stop and make sure there's time to clap and acknowledge everybody's contribution as well. And again, keep using that social media, because I'm sure the winners want to help you to help them celebrate their award. So the first one then is the Public Involvement Award. This award recognises the very best use of public involvement in a health and social care research study using the UK standards for public involvement. The category received a very strong field of applications, with the judges remarking on the variety of innovative public involvement activity. There is a winner. I'm afraid there has to be a winner, and only one winner. The winner in this category is the GPs in ED study. So the judges... The judges, I'll just say a little bit about it, and we got a little bit of a video to play. So the judges were impressed by the study's commitment to public involvement and their efforts in building and maintaining valuable and meaningful relationships, collaboration with members of the public over a 6-year period. It was noted how challenging this can be to sustain, especially in a primary care setting. The judges believe this to be a leading example of the influence that public involvement can have on health and social care research. It was fantastic to see the team embracing the UK standards for public involvement and focusing on capturing and measuring the impact that public involvement was having through the life of the study. So congratulations. We're going to play a bit of a video and Julie Hepburn is going to come up to the stage to accept the award. So while we're playing the video, Julie, make your way to the stage. Thank you.
Our entry for the Public Involvement Award is our story of 6 productive, collaborative and rewarding years, working together designing, delivering and disseminating a major research study about how GPs work in emergency departments. From the earliest stages of conceiving our study, through to delivering the findings, we have exceeded our expectations, helped by the use of the UK standards for public involvement throughout. Our public contributor colleagues, Julie and Barbara, were involved more often than we anticipated. They took on a wider range of roles than we'd planned for. They looked for ways to improve the public involvement processes and put these into action. They affected the research, amending patient recruitment methods and dissemination, and positively changed attitudes of other members of the research team towards public involvement. To share what we learned, and ultimately to help improve processes and impact of public involvement in research, we published a paper reporting our experiences and identified 10 steps to help research teams effectively involve people in research.
Okay, brilliant. Unfortunately, Bridie can't be here this afternoon, but Julie's come to accept this on our behalf, so we'll present her with a certificate. If we could give her another clap, if that's okay. Sorry about this, folks. Congratulations. Thank you very much. Thank you. Okay, that's the first award done. Let's move on to the second category. The next category is the category of impact. This award recognises the difference that Welsh health and social care research is making to people's everyday lives. So overall comment from the judges. The judges were encouraged to see the breadth of research taking place and the impact and influence the research could have on patients, practice and policy. There were 2 standout applications and the judges decided to honour both of them. 2, joint first. Ooh, that's unusual. So the 2 winners in this section are, the first one is the SAIL Data Bank and Partners of the One Wales COVID-19 response. And the second one is the Future of Unpaid Carers in Wales research project. So just a little bit about those, and then I'll stop, we'll watch the video, and colleagues can come and join me on the stage. So the judges described the SAIL Data Bank and Partners One Wales COVID-19 response application as phenomenal, demonstrating impact across a global pandemic. While the Future of Unpaid Carers in Wales project demonstrated genuine impact and collaboration in an area aligning to important Welsh Government policy. So congratulations to both winners. Let's hear from Bang Hu Hoang and also from the SAIL database, and Professor Ashley Abaki from that as well. Thank you both. If you want to make your way to the stage as well and come and accept your awards.
The One Wales collaboration was established and led by the Population Data Science Group at Swansea University, enabling opportunities and providing vital COVID-19 research and intelligence to policymakers in Welsh Government's Technical Advisory Group and the UK Scientific Advisory Group for Emergencies, known as SAGE. The One Wales response brought together multidisciplinary experts from across organisations around Wales and the UK using the SAIL data bank. Collaborators worked together across as many partners to provide timely evidence to tackle the pandemic and its impact on people and services. The One Wales collaboration enabled and contributed to impactful intelligence and research in areas such as analysing the impact of shielding on people's physical and mental health, evaluating the impact of COVID-19 on schools for people and staff, geospatial modelling to graphically illustrate the spread of COVID-19 in Wales, the impact of COVID-19 on care home residents, and longitudinal analyses and evaluation of the UK vaccination programme, including associated uptake, safety and efficacy of the vaccine.
Hello, I'm Gofal Dr. Fang Zhou, it's my pleasure to introduce our project, The Future of Unpaid Carers in Wales, on behalf of our research team. This project is a collaboration between Swansea University and Public Health Wales. So there is a lack of understanding on the impact of caring on unpaid carers' own health. Neither there is detailed guidance in practice on how to better support unpaid carers' education, mental well-being, and physical health. Our project provides critical quantitative evidence showing that young carers are more likely to live in the most deprived communities and less likely to engage in higher education. And unpaid carers present poor mental well-being when caring hours increase. We create the very first electronic registry of unpaid carers in Wales, with over 62,000 unpaid carers identified. We find unpaid carers are more likely to be diagnosed with 36 long-term health conditions than non-carers. Our research findings are used to inform actions in a strategy for unpaid carers delivery plan by Welsh Government this year. Will continue informing the current development of the new Charter for Unpaid Carers in Wales. Thank you.
Do you want to do all together? This way? Yeah, move away, yeah. There you go. If I hold the bottom, there you go. Brilliant, thank you. Well, congratulations. Two great examples there of research in action already, so brilliant, well done to both. Just in this section as well, there was a highly commended, so I think I should give that a mention. The judges would also like to highlight Dr. Claire Nollett's research project, co-designing a mental health training programme for frontline staff in the sight loss sector, which they say shows great promise for potential high impact for the future. So congratulations to Claire as well. Okay, and our third prize award of the day is the Rising Research Star. This award recognises those in the early stage of their health and social care research career who are already making an outstanding contribution in their field and or developing as emerging leaders of the future. So the overall comment was, members of the judging panel were very impressed with the strength of applications in this category, particularly the commitment to research shown by healthcare professionals. It really was a difficult decision with so many candidates showing tremendous potential. But there is a winner, and the winner is Dr. Katie Lewis, the Sir Henry Wellcome Postdoctoral Research Fellow at Cardiff University. So congratulations to Katie. So the judges were very impressed with Katie's application, describing her as an extremely strong candidate. Katie's achievements in securing a prestigious Wellcome Trust funding and also her links with Harvard Medical School set her apart from the other candidates. The judges believe that Katie's research in the area of sleep and mental health could have a huge impact, and she is definitely a rising research star. So congratulations from Katie. Katie can't be with us today, but we are going to show her video and we'll make sure that she gets her cheque and her certificate. So thank you.
Hi, I'm Katie Lewis and I'm a psychologist at Cardiff University. My research focuses on sleep and mental health, and I've been awarded as the Henry Wellcome Postdoctoral Fellowship to continue this work. In my fellowship, I'll be looking at how we can use information from digital technology, genetics and brain activity to understand if, how and why sleep affects our mental health. I'm also very passionate about public engagement, and I've worked with many groups including the NHS, Gwent Police and Public Health Wales. And this year I was awarded a Wellcome Trust Public Engagement Grant to work with young people in Grangetown, Cardiff. Here we'll be creating artwork to raise awareness of the things impacting young people's sleep, as well as working together to develop teaching resources on sleep that can be used in health and wellbeing lessons across secondary schools in Wales. My long-term goal is to use my research to improve provisions for sleep education in Wales and increase people's access to help for their sleep.
So as I say, we'll make sure Katie gets her certificate and her cheque. They were actually also highly commended in this category as well, which I do want to just mention. So the judges would also like to highlight the strength of the applications from Dr. Julie Picone and Adam Williams, both achieving an incredible amount in the early stages of their careers, and candidates to watch out for in the future. So I don't know if they're both with us, but they probably deserve a clap as well. So thank you. And finally, from me, the final award is for the Best Interactive Stand at the exhibition today. So I know there's some people listening out keenly near the back of the auditorium for the awards for this. And of course, you've all been voting all day on who should win. So thank you for your votes. I'm going to do this in reverse order, if that's okay. So in third place, we've got Brain. So congratulations to Brain. In second place, Wales Kidney Research Unit, so congratulations to you. And in first place, the Centre for Ageing and Dementia Research. So if somebody from CADA could come to the stage, we do have an award for you, so thank you. Oh, then nobody can decide who's coming now, so come on. You can all come if you want. Thank you. Everybody's quiet now, waiting for an over. Oh, gosh. Congratulations.
Thank you so much.
Very nice trophy. Oh, that's lovely. Very smart. Are you going to join us?
Of course, yes.
Director. Yeah. Oh, there you go. Make me look thin. I think you've got that lens on. Okay. And that's all from me. Kieran, I'll hand back to you if that's okay. Thank you all, everybody.
Thank you so much, Judith, for that and for coming to close our conference. That's pretty much it. I forgot earlier to remind you about the evaluation. It's terribly modern. There's a QR code on the programme. Scan the QR code. It will take you to the evaluation. If you don't fill it in, you get at least 6 months bad luck. So I do encourage you to complete it. That's evidence-based, completely evidence-based. So, no, we really want you to fill it in because we want to make the conference next year, which again will be in person. We want to make it even better. So please do fill in the evaluation. That's a wrap. I hope you've enjoyed today. I think it's been lovely to see everyone in person again. And have a safe journey home.